Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Thanks for joining. Today is August 9th, 2022, and as always, we are here to take your questions live about MPV, monkeypox, about COVID, and I'm pleased to have a special guest today. This is CEO Pedro Martinez of Chicago Public Schools. I know a lot of you know him already, and certainly thanks for coming back again. I think it's been a good opportunity for us to just answer questions together. School's coming up soon. When are we going back?
August 22nd. So, I mean, time is flying by. I know kids are hopefully counting down the days. I know parents are, for sure. So
Right.
August 22nd.
Absolutely. And there's been a lot of messaging out. I know CPS sent letters out already to parents explaining some of the COVID protocols, et cetera. But we thought it'd be a good opportunity just to get on together and answer your questions ahead. So what we're going to do is we'll pull up the dashboards. I'm going to show you where you can find information about kids on the CDPH COVID dashboards, because that's something we get questions about. Then I'm going to do an MPV, a monkeypox update, which is not related to kids, but important to get out. And then we'll transition back to COVID and talk about all things CPS. So as always, you can go to chicago.gov/COVID-, and we'll go ahead and pull that up for our COVID dashboard numbers. And if we just take a very quick look, you can see most of this is green, which is good. We're averaging about 2,000 COVID vaccines a day, about 700 COVID cases being diagnosed formally today. And just to start laying the groundwork here, we'll expect those numbers to go back up when kids are in school, not because school is a significant place of COVID spread, but because CPS is going to be doing a lot of that screening testing again. And when a lot of people get tested, we know that we find cases, but it's one of the best ways to help stop the spread and keep schools safe. Hospitalizations and deaths are looking fine. I want to show you, just as a reminder here, if you want to see what's happening with children, and you click on cases here, and there's lots of things that you can see. So you come here and you click and you say, I want to see it by age. And this will tell you, what is the current daily average. So right now, in 0 to 17-year-olds, we're averaging just under 100 COVID cases being diagnosed in Chicago each day formally, not counting at-home tests, which of course would be many more. We're averaging between 1 and 2 children being hospitalized every day with COVID in Chicago, and we're averaging 0 deaths in children, and in fact in most adults right now. So that gives you a general sense of where we are, and you're welcome to play with it and look at more of the details. And explore here. I do also just want to show you one other place under vaccine effectiveness. If you click down here, you can look at this all by age as well. So this is where every week we update with Chicago numbers for COVID deaths, COVID hospitalizations, and COVID cases by people who are unvaccinated, vaccinated but not boosted, and then boosted. And so this is the top line graph where overall our deaths, since the Omicron variant became dominant, people who are unvaccinated had almost 3 times as likely to die of COVID compared to folks who are fully vaccinated, and 6 times more likely to die than people who were boosted. And this red line is what we don't want. And a lot of people write in and they say, should I really get my child vaccinated? I'm not sure. And so I thought I would just show you, the same patterns hold. This is the whole population for hospitalizations. That blue bar at the bottom is where we want to be, really as low as possible for cases, hospitalizations, and deaths. But if we go by age group here, this defaults to all the age groups, but you can come over here and let's just look, for example, at 12 to 17-year-olds. So we don't have a lot of deaths, which is obviously a very good thing. We've had 8 deaths total in all of COVID in children under 18 in Chicago throughout this time period. But here's COVID hospitalizations by vaccination status among 12 to 17-year-olds. And again, the solid line are people who are unvaccinated. So you can see this, that even in kids, being unvaccinated is a significant risk factor for being hospitalized, for getting seriously ill, and that's the top reason why we want folks to be getting vaccinated. Let's look even at sort of the 0 to 4-year-olds, for example. I'll take the 12 to 17-year-olds. All the hospitalizations in kids who are unvaccinated, and so again, the risk is certainly lower of a severe outcome, thankfully, in a child than it is in an adult or especially an older adult, but vaccination absolutely makes a difference, especially for severe outcomes. And it also, sometimes I hear, oh, it doesn't really help with cases. Like, let's look at 12 to 17-year-olds in cases. And you see the same thing, that solid line are 12 to 17-year-olds who are unvaccinated and being diagnosed with COVID. And then, those rates are higher than people who are vaccinated and boosted. So I just wanted to show you the Chicago data behind why we continue to emphasize this. All right, I'm going to go ahead and turn to a little bit of monkeypox update and some slides, and then we'll come back to COVID, all right? So first of all, we've been talking a lot about monkeypox, or MPV as we're more often calling it in Chicago, and I refer you back to our last 3 or 4 Facebooks if you've got lots of questions. But here's just very high level. What are the risk factors for MPV based on what we know so far? Clearly, the highest risk is sexual or intimate contact. And even wearing condoms, it decreases but does not eliminate risk. And that's because if you have direct contact with the infection, rash, scabs, body fluid, that's how it spreads. And so, just to sort of translate this to schools for a second, we are not concerned at any significant level about MPV in schools, because we do not have sexual or intimate contact in schools. We don't have this sort of direct contact if there were to be people with infections. So I just wanted you to understand that by far that's the highest risk. There is some risk, and this is where we're still learning, about things like kissing or cuddling, dancing at a crowded party if people aren't fully clothed, potentially sharing drinks if someone had MPV, or sharing a bed or towels or personal toiletry items. So again, the few examples that we've seen of cases that haven't been through intimate contact have really been in household members. Kids, for example, there have been no children diagnosed with MPV in Chicago and Illinois. There have been a very small number of children diagnosed across the US. Those have been household members of known cases. So, kids sharing the same towel that, a family member is, for example. And based on what we know now and how the MPV virus is behaving, it is unlikely to have a risk factor of, dancing if people are clothed, coworker to coworker transmission. And that includes, we've not seen transmission in healthcare settings, touching doorknobs, trying on clothing, traveling, airports, planes, swimming pools, hot tubs, bodies of water, public restrooms, public transit, grocery stores, coffee shop, gym, via equipment. None of these at this point look to be significant risk factors at all. So this is very different from COVID. And I wanted to just highlight, we get this question a lot. What is the risk of being exposed to MPV at the grocery store, in a busy coffee shop, on the CTA? So monkeypox is not spread through casual conversations or walking by someone with monkeypox like you would in a grocery store, like you would in school. MPV, it's not as contagious at all as influenza or COVID-19. And you do not become infected by being around infected persons unless you have prolonged close contact or are sharing bedding, clothing, etc. So really, I just wanted to emphasize that in terms of concern, there are certain groups that we're quite concerned about, but in the general population, and especially among kids at this point, not a major worry. MPV, as we said, is spread through close contact. I'll refer you to the website if you want to learn a little more about this, chicago.gov/monkeypox. There's lots of information. Anyone can get MPV, but almost all of our cases here in Chicago, in Illinois, around the country have been in gay, bisexual, and other men who have sex with men. And that is just because that is the social network where people are having close contact. If somebody thinks they have monkeypox and they've got a rash or sores or some of these other symptoms, really we want you to just separate until you get tested. Call your doctor. Any doctor can test. They'll take a swab of your lesion and send it off. And if someone is diagnosed with MPV in any setting, at home, in workplace, in a school, the Chicago Department of Public Health does the case investigation, the contact tracing. We would work to get vaccine to any known close contacts. So again, this is not something different than COVID that we're asking schools or workplaces to be doing anything different about, doing case investigation, any of that. So quickly, where are we with the MPV outbreak? It continues to grow. As a reminder, where those blue dots are in West Africa, that's historically where we will see monkeypox. And usually it's been animal to human spread, contact with small forest animals. But this outbreak has been more spreading person to person, again, primarily through sexual contact. It's in 88 countries and now over 30,000 confirmed cases. Across the U.S., we're at almost 9,000 cases, and you can see the range here. Chicago is at over 550 of those cases, and those cases are across Chicago. 60 of Chicago's 77 community areas now have at least one confirmed case, and even in the community areas where we don't have confirmed cases, my assumption at this point is there probably are people who may have a mild case and may not have been tested. So I just want to emphasize that this is widespread. This is not a disease that is just in one part of the city, but it is in a very particular group of Chicago residents for the most part right now. So if you go to our website every day, Monday through Friday, we're updating at chicago.gov/monkeypox, chicago.gov/MPV, numbers, demographics. So we're at 556 cases. 30 people have required hospitalization, about 5%, 1 in 20, and that's been pretty consistent throughout. We've had no deaths. That's true in Chicago, Illinois, and across the U.S. at this point. So that is also reassuring, but certainly people are having pain. These can be pretty significant lesions and getting hospitalized for that. There is treatment available for people who are immunocompromised or more seriously ill, which is another reason that if you're concerned, it could be MPV, go get tested so we can get you treatment, we can get people around you vaccine. These are the demographics. Again, you can look at this online every day if you want. Most of our cases continue to be in the people in their 20s and 30s. 46% of the cases have been in white Chicagoans, 30% in Latino Chicagoans, 16% in black Chicagoans, 4% in Asian Chicagoans. And if we look at the demographic sex, 99% have been in men. We've had 3 women diagnosed at this point, 2 women, 2 transgender women, 1 transgender man. But of the people who report their sexual orientation, 97% have reported being gay or bisexual. And so, again, this is just the social network that this is spreading in right now. But for people who are, especially men who have sex with men right now, that risk is high if there are new partners, anonymous partners. But for the general population at this point, risk does remain low. MPV testing is going up really nicely, so we've been pleased to see that. That also drives the increase in numbers, so that's a good thing. Any doctor's office or clinic should be able to diagnose this. We've had almost 50 clinical sites, urgent cares, primary cares, STI clinics diagnose successfully, so that's good. And then we've got vaccine providers all across Chicago. On the right here, these green dots show where we're doing larger scale vaccination, but even in addition to these, there are dozens of other providers that have received a small amount of vaccine. If they diagnose a case, we want to make sure those contacts can be vaccinated. I want to note that CDPH is operating 3 clinics, STI clinics. We always do, but we've put vaccine there in Roseland, in Austin, and in Lakeview. Little tiny bit of background on vaccine for MPV. The brand name is Jynneos. This was fully FDA approved prior to the current outbreak. So different from COVID, we had treatment available, we have vaccine available. It's just that it's historically a very rare disease, so there's not a lot of it. There's only 1 manufacturer in Denmark, and so we're working to, the US is working to get more, but it really is as it is allocated to Chicago. It's approved for preventing smallpox and monkeypox in adults over 18 at high risk of infection. I do want to note that there's special paperwork that can be done if there were a child that needed vaccine, and we know how to help with that. And it is safer than the older smallpox vaccine, if some of you got a smallpox vaccine when you were younger. A full course is 2 doses administered at least 28 days apart. But given the limited vaccine supply, unless people are known contacts of a case or immunocompromised, we're giving more people first doses and holding off on that second dose at the moment. And this is just, we get so many questions about this, so I thought I'd just lay out the numbers. MPV vaccine supply is increasing, but demand still far outstrips supply. So between early June and mid-July, we got about 5,000 vaccine doses total from the federal government. So that was really the time period where a lot of people were needing to wait in long lines, and I know it was very frustrating. Then July 23 to 24, we got about 15,000, our first really big shipment. All of those have been distributed. 96% of all MPV vaccines in Illinois have been administered by Chicago providers, given that this is where the focus is. And then just last week, August 3rd, we got another 13,000 doses. And that's been good because now we're finally getting to a point where we're able to do some of these larger clinics, hundreds of vaccines, more than 1,000 vaccines in one setting, and having more availability. So that's been really good. Just this last weekend, we had more than 2,000 vaccines given between a combination of things with market days, but also like there was an event down in Jackson Park, did 120 vaccines there. So it's been good to see this ramp up. We do expect about 20,000 more doses coming from the federal government over the next few weeks and more coming. The first priority is vaccinating with what we call ring vaccination, all contacts of cases. And so we've gone over this before, so I'll just go relatively quickly through it. Right now in Chicago, you are eligible for an MPV vaccine, first and foremost, number one, if you have close contact with someone diagnosed with MPV. No restrictions, that's who gets top priority. And then secondly, if you're a gay, bisexual, or other man who has sex with men who also has another risk factor, especially multiple or anonymous partners, having sex in having intimate contact in a social or sexual venue, etc. And just as a reminder, given the supply, MPV is not recommended for the general public at this point, and that includes same gender loving men who don't have other risk factors. As vaccine supply increases, guidance may evolve. And we do have some availability. I have not been able to say this very clearly before last week. We've been obviously mostly getting this to the highest risk settings, but we're starting to be at a point where people can now sign up. And so I want to encourage people to follow CDPH on social media. These are ours. We've got appointments at the Lakeview Clinic, the Austin Clinic, and the Roseland Clinic. You see the code and how to sign up. And I actually just pulled this, and this is what was here this morning, showing that, at the different clinics, there are some days we have 1 or 16 appointments. One day there's 200 appointments. And this is just our routine every single day. So you can sign up and get a vaccine potentially this day. Today, tomorrow, the next day. But it's by appointment only, just given that we need to keep following this. And then this weekend, we're going to have a number of larger vaccine events. So I'm really pleased to announce, and I want to thank Rush and UIC for joining together with the UIC School of Nursing to do a really large clinic. We're going to have about 1,500 vaccine appointments here on Sunday, August 14th. You can see the same criteria there, but we want you to make an appointment. So there's the link, uicourt.setmore.com. And then similarly, CDPH is planning to have some larger Saturday clinics, but right now those codes have been released to our community partners, especially Black and Latinx serving community partners, because we're trying to think about equity and prioritizing vaccine. But a little later this week, if there is still space available, we'll also make those available. So my point is, if you live in Chicago and you meet those criteria for MPV vaccine, there's a very good chance that you can be vaccinated this week, and we would like you to sign up because we want to make sure, of course, that all vaccine is being used. I know there's going to be questions, so I thought I'd show a couple things here. We are expecting that now that an emergency declaration has been declared at the federal level for MPV, that there will likely be an emergency use authorization, which would allow us to stretch the existing MPV vaccine supply. Right now, it comes 1 vial, 1 dose. And that is a very easy way operationally for us to do vaccines. And it's a more traditional vaccine with a deeper injection. The plan is based on a study that if you instead inject this MPV vaccine just under the skin, you see that picture there, you inject it very shallow and it creates almost a little bump under the skin. And if you've ever had a tuberculosis skin test, a PPD, it's kind of like that. And if you do that, per this study, you could divide potentially each of those vials into 5 doses. So that's a way to right away say you could vaccinate 5 times more people. But I want to be, and I think this is a good approach overall, but I want to emphasize that this is not a done deal yet, that there's different training, there's different smaller needles and syringes. We've got to get updates sort of from the federal government, and then we'll be sort of of communicating out about this. So right now, this is not the technique yet that we are recommending, but it may be coming to be able to stretch vaccines. So that's the answer there. And I just want to thank the hundreds of partners. We literally have about 250 partners joining our Friday organization calls at this point. And we've got so many clinical partners partnering with so many sites and LGBTQ focused events and locations. And it's really been a good rollout, I think. When we look at our data, a lot of our highest risk folks have gotten vaccinated. And just want to thank, this is just a sample of where we've been over the last couple of weeks. And the last thing I'll show before we turn to COVID is just a comparison between what are we seeing in Chicago for cases versus vaccination. And this is when we're thinking about equity and where is vaccine getting. This is some of the data we look at. So on the left, this shows you that, yes, we have seen the largest number of MPV cases up in the north here. We've also seen the most vaccines administered up in the north here, and this is by resident address. And you can see that overall, actually, our cases versus vaccination is matching fairly well. But I'm a little concerned that people may be less likely to get tested, especially on the south or the west side. And so we, of course, want to make sure that vaccine and testing is as available all over the city. But this is actually a pretty good match. It's also a good match on sex, not surprisingly. Almost 100% of our cases and 96% of the vaccines given in Chicago have gone to male Chicagoans, as you would expect. Good match on age. Again, cases on the left and vaccines on the right. You can see those are pretty close to each other. And if we combine the age groups, 77% of our cases and 73% of our vaccines have gone to Chicagoans aged 25 to 44. So we're quite pleased with that too. And I want to thank everybody who's been doing the different kinds of outreach to the different groups. Where we are a little concerned and why we've been prioritizing appointments through some of the especially Latino and Black serving LGBTQ focused organizations is we are seeing more white Chicagoans vaccinated compared to the percentage of white cases. So in red here, 45% of our cases, this is as of a week ago, we update these about once a week, have been in white non-Latinx Chicagoans, and about 55% of vaccines have gone to white non-Latinx Chicagoans, whereas you can see 29% of the cases have been in Latinos and about 14% of the vaccines. So we've been doing a lot over the last couple of weeks to work on this, and I expect we'll keep making progress here. But one of the reasons we don't just release all the vaccine appointments at once is that we first and foremost make them available in parts of the city and to subsets that we see lagging on any of these indicators, whether it's age, geography, race, ethnicity. So just wanted to explain that. There's a lot of information. You are welcome to download it, spread it, share it. These are some of the palm cards we were handing out at events this last weekend. And just as a reminder, if you were at market days these over the weekend, we were very pleased with how it went. Lots of vaccines, lots of education. Just know the risk factors and please monitor for symptoms after the event for 3 weeks. If you think you might have been exposed, you get symptoms, stay home and talk to your healthcare provider. As always, you can follow chicago.gov/monkeypox or give us a call. And either of those numbers will work. And do follow CDPH on social media, Facebook, Twitter, etc. We're putting up-to-date vaccine appointment and registration every day. So let's move quickly to COVID, and then we'll get into schools. I know that was a lot, but there's been a lot happening in MPV, and I'm actually out on vacation next week, so I wanted to make sure we got in a good update. So 81% of U.S. counties are at high or medium COVID level. That includes, Chicago, Cook County have been at high for a while here. Cases are down just a little bit. So that's reassuring, but we've not moved out of that high level. Variants, it is all Omicron. It is nearly all BA4 and 5, which is the blue there. I'm pleased we've not seen a new emerging variant. I will just say that. But this is the most infectious version we've had yet. And that's also true, all that green across the country, that's all Omicron. As a reminder, and starting to move into, this is relevant for school, this is relevant for every setting. If you catch COVID-19, regardless of your vaccination status, you need to stay home for 5 days. That's true if you're a child, if you're an adult, from school, from work. And then if your symptoms are resolving or you're gone by day 5, you can leave your house, you can go back to work or school, but you must continue to mask while around others for days 6 through 10. That has not changed. Theo Martinez, that's going to be the fact in CPS, right?
That's right.
Yep. And so this is really, we want people to hear this loud and clear. That is not changing, and this is important. It doesn't, regardless of whether you've tested, regardless. At home for 5 days, mask days 6 through 10. And then just as a reminder, please get your booster now. Everyone over the age of 5 should have had a vaccine booster if it's been 5 months since they finished their series. And we'd like people, of course, up to date before they're back to school. Only about 9% of Chicagoans under 5 have gotten that first dose. I will tell you, I'm not real pleased about that as we head into school and we think about the young kids, and it hasn't been for lack of opportunity. So I know CPS is working and we're working to continue to grow this, but you know, I just don't want your kids to get sick. I don't want them to get hospitalized, and I am a little worried that as we're fully back in the fall season, we may have some troubles here. So just, it's a good time right now ahead of school to come up to date. We don't have a COVID vaccine clinic this weekend because we're going to be using the sites to do some big MPV clinics, but we'll be back August 20th, and our vaccination at home program continues to go strong. Give us a call. We will bring any Chicagoan over the age of 5 a vaccine. Not over the age of 5. We will bring any Chicagoan over the age of 6 months a vaccine, no problem, at your home, Saturday, Sunday, Monday, Tuesday, morning, afternoon, evening. And Chicagoans age 5 and up can get a $50 gift card for booster doses. That was the part I was looking at. So there's where you can call, and I'm going to hand it to you to do some CPS, just high level, and then we will take your questions.
Well, first of all, thank you, Dr. Awadi, for your leadership in helping both CPS and our city navigate through this pandemic. So a few things, for our community. One is, COVID is still here, so it's not gone away. Our cases are still in our city. We expect cases to come in our schools. We also do expect some new guidance from the CDC that's going to affect schools. And I just want our families to know that what we're going to share with you, we're already anticipating what some of those changes could be. So that is already reflected in much of the guidance we have. And we always work with Dr. Awadi and her staff. We're in communication on a weekly, sometimes daily basis. Yep. Whenever we see either guidance that might be shifting or the fact that what we're seeing in our schools. And also for our families to remember, 90% of our schools were open over the summer. We had over 91,000 students we were serving over the summer. So even though the school year ended, we continued our protocols, our programs throughout the summer, and I think that is going to also help us to have a much smoother opening this year. So let's go into it. I'll just continue to be a broken record, just as Dr. Awadi has. There is no better protection than vaccinations. And you'll even see one of our goals for the new school year is having our children be safely learning in our classrooms. That is our overall arching goal. We want all of our teachers, we want our children in person. We want it to be in a safe way. The best way to accomplish that, families, it is through vaccinations. And now we have vaccinations available for all ages. We will have all of our clinics. We will continue to have vaccination events. We have them both at clinics. We have 4 permanent regional clinics, plus we have mobile events. So not only can you get vaccines at home through CDPH, we will also plan with your school a mobile event at your school as well. So please know that we want to make it as easy as possible. We're going to continue our weekly COVID testing. And for families, I want you to know this. We'll be one of the few, if not the only large district in the country that's going to continue to have screening testing. What is great, though, I still remember those days, and this was around the holidays, how difficult it was for us to access testing. We now have so much supply of testing for home tests. We have literally millions of home tests that will be available for us during the school year. And in addition to that, we will have screening testing. The one thing I want you to make sure you remember, and we sent this notice out on Friday, we sent the link to every single family to update your form. So please update your consent form. Your old consent forms, they were good through the summer, but they will not be sufficient for the new school year. It's a new form. We hope it's an easier form for you to fill out, but please fill that out for both staff and for our students. Oh, and the other thing, just before I forget, I'm sorry, is the testing, because this will be for the whole district and this will be at all of our schools, testing will start in the second week of school, which is August 29th. Our first day of school, of course, is August 22nd. I can't wait to see everybody, but August 29th is when screening testing will start. One of the things that we had, just some great lessons. So we started our Test to Stay pilot back after the Christmas break. We started with one school. We expanded it to over 40 schools by the end of the school year, and we continue that into our summer programs. And what was a great lesson, Dr. Awadi, was less than 2%, about 1.5% of our students, we found that were close contacts actually contracted COVID. So in other words, 98.5% of our students, which stood in the classrooms even after we had cases in the classrooms, were consistently negative during that period. So for us, it just really tells us that it is very possible, families, to have our families safely in school, still learning, even as we're having cases in our community, and of course when they come into our schools. But some important details that we want to share with you. And this was all in the written guidance we sent families on Friday, but I want to repeat that. So if you have, this year, when you have an unvaccinated individual that's deemed a close contact, they're going to have 3 different options. So one, maybe we're not up to date on your records. And please, families, know that our nurses across all of our schools will be accepting any vaccination records that you need to give us, whether it's COVID or non-COVID. So please know that you can do that in any one of our schools. Our nurses will be there ready to receive it, to update our files. So we might have a child that we think is unvaccinated, but really is vaccinated. So we want you to just go ahead and provide us that proof of vaccination. Just give us a copy, and then we'll update our records. Our families will be able to have their children, or our staff for that matter, if it's a staff that's positive, will be able to stay home. And as Dr. Awadi said, we don't expect any changes in guidance. So anybody who is positive or who's been a deemed close contact can choose to be at home for 5 days and then come back on day 6 with masking. So that, again, that's another option. Of course, what we really want is for all of our students to participate in the Test to Stay, because we're having such great results. And in that mode, what we ask is for children who are or staff who, as long as you don't have symptoms and as long as you're not positive, you can take 2 home tests on the following Monday or Thursday after exposure. And for families, we will let you know, we'll even remind you, please, your child maybe was exposed on Wednesday, you'll have the home test for that following Thursday. Or maybe your child was exposed on Friday, you'll have the home test for that Monday. But we ask you to take 2 tests both on that following Monday and Thursday. As long as they're negative, your child will be able to stay in school. They'll be able to continue to learning without any risk. We do ask, though, that especially if we see multiple cases in a classroom, right now CDPH identifies an outbreak as 3 cases. If we do have multiple cases, we will ask the whole classroom to mask, and that will be in concert with CDPH. So again, families, we just want to make sure we're always just practicing as safety as a top priority. But we'll work with families on those specific situations. So masking right now, even though our county is on high, every time we look at the data in the city, our city has been faring better. So we are still seeing low hospitalizations, low deaths, and so again, we will continue to work with CDPH. Right now, as of today, and as we're planning for the first day of school, we're not going to require masking, but we still strongly recommend it, especially for families, for students who are unvaccinated. We still find it to have quite a bit of protection, and it does limit our cases in our schools. So again, we will continue to do that. Again, just to repeat this, if somebody is positive, and regardless whether they're vaccinated or not, they will have to be at home. They'll have to be at home for 5 days or longer if symptoms continue. And if they can come back on day 6 if they don't have symptoms, and they have to continue to mask. That we just want to continue to repeat that, please. We're going to continue to follow that. Let's see. And then, of course, everything is in consultation with CDPH. And so, going back to, if we have what we call an outbreak, which is 3 or more cases in a single classroom, we will ask the entire class to mask. And that's families, whether your child is vaccinated or unvaccinated, and that will be in concert with CDPH. And that is mainly, again, just to make sure that we're being as safe as possible. The last thing we want is for more cases to happen in a classroom, for us to have to isolate more children. We want our children to be in classrooms and to be learning safely. And then some of the additional protocols that we will continue to invest in, of course, making sure that all of our filters are up to date, that we have, so that we continue to prioritize that, as well as we are, as we speak, cleaning and disinfecting every single classroom, every single school space. We're literally, our custodians, God bless them, are working 3 shifts from 6 a.m. till midnight. We're going to have every school families deeply clean. So just know that that's happening as we speak right now. And then, of course, we'll continue to do contact tracing. With our test to stay, we do look at, any cases in classrooms. We do consider all students as close contacts. So again, but we will have our test to stay continuing, where again, as long as families, if you're unvaccinated, as long as you're willing to take your home test and you're negative and you don't have symptoms, well, again, you'll be able to stay in class as long as you follow the protocols we shared earlier. And then with that, questions.
All right, great. So I know that was a lot of slides, but it's a lot of information to get through, and we will move now directly into your questions. Maybe just to start off a little bit, because I've got one just to kind of pull this together, and then I'll get into people's. So, I hear you talking a lot about keeping kids in school. And of course, this is something that we really share, where we've seen learning loss. We want to do everything we can to be safe,
yes,
but also in school.
Yes.
And so that test to stay, again, just kind of high level to make sure we hit on it. So the idea is, I know a fair bit about this. I just want to make sure you understand. The main reason to do this is it lets people stay in school.
That's right.
But we put extra testing in place, a little bit of extra masking, extra, if especially where we've got less vaccinated schools and we're more concerned about them. It's a way of, first and foremost, working on keeping kids in school. And I really want to commend you on that approach and on all of the things that you're doing here to balance, of course, people's desire to keep their children safe and healthy, but also work on keeping them in school, because that really I see as critical. So if you just want to chime in on that, I wanted to
absolutely,
underscore
Dr. Awadi. So one of the things we saw last year, for example, our high school students were able to stay in school a lot more. And frankly, we saw more academic success with our high school students. We had, unfortunately, we had a lot of children that had to be isolated last year, and we saw an impact academically. We saw an impact, frankly, on their social and emotional well-being. And so for us, when we started our Test to Stay pilot, and we were able to go up to 40 schools, and we continued into the summer, when I saw that the results were over 98.5% of the students continued to be negative, even while there were cases in their classrooms. That is an important data point. The other thing families to know, again, if your child's vaccinated, that extra protection is already factored into the Test to Stay. So again, those children we've been allowing to stay in school. For our children that are unvaccinated, as long as they have negative tests, we're just asking that please, take that test. You'll be able to stay in class. If there's not a cluster, if there's not an outbreak in the classroom, we will continue to work with the classroom on specific masking requirements. But in general, our unvaccinated students will be required to mask through the 10-day period, and then we'll work with all of our students, especially if we see a risk. We may have to have the whole classroom mask as well, just as an extra precaution. But it is only for that 10-day period, parents.
Yeah.
It's not anything longer than that.
Yeah. So I tell people, you don't have to wear a mask that first day of school, but you should make sure that you've got a mask that is comfortable for your child, that fits them well, because chances are pretty good for short periods during the year, they may need to wear one if there have been cases, et cetera. So, plan to have some. I know CPS also has some available. Yes. But we are at a different place than we were. So let's get into some of these questions.
Yes.
Yvonne Ramirez on Facebook says, are you concerned about the fall and winter, particularly with so many other health concerns and children going back to school with little to no guidelines in place? So I want to just emphasize one of the reasons we're sitting down is to explain the guidelines, because there are a lot of guidelines in place. But talk a little bit about, coming back, fall and winter. How are you thinking about health?
Sure. Well, one of the things that I am very optimistic about is when we've learned so much last year and even over the summer, and I could even sense, because again, we had over 90% of our schools open. We had over 91,000 students we served, all grade levels, from pre-K, incoming pre-K students, all the way through 12th grade. And so what we saw very, frankly, we were able to manage through the pandemic. We saw, even though we had cases, we were able to keep children safely being in school. So I am very confident as we move into the new school year. I think we're in a better place today than ever. We will also make sure that every class, every school, Dr. Awadi, will have the masking, the PPE that is needed without exception in every single school. So I actually feel that we're in a very, very good place. Our guidelines are very detailed, so again, for families, we will continue to give even more details as we get closer to August 22nd. So our goal is to just, frankly, for our parents, to really work with you in partnership, because we know that we can do this, and we know that our children can be in school in a very safe way.
Here's a pretty straightforward one from Megan. As a parent, will I be notified if there's a positive case in my child's classroom?
So we will continue our correspondence to families whenever there's any cases in classroom. In fact, it's even more important than ever. Why? Because we're doing test to stay. So in other words, if you are vaccinated, you will still know there's a case, but you'll know that because, again, you can choose to do home tests. I'll tell you, in my family, my children are vaccinated, we're going to do home tests just to make sure, that's the kind of parents we are. We want you to have that option. For our unvaccinated students, of course, you're required to do home tests on that following Monday and Thursday in order for you to stay in classroom. So yes, every family will be notified.
And here's another pretty straightforward one. If I want to opt in to test to stay for my kids, do I need to pay for those tests? Do I need to get the tests? I don't understand how I get a test.
So we have millions of tests right now that we have. So every family will be able to be provided home tests as you need it. So the priority will be our unvaccinated students, but any family who requests home tests, please, you just work with your principal, work with the nurse in the school. We will provide those for you.
All right. Alexandria Deanne on Facebook says, do you need to test out of isolation? Why did President Biden wait for a negative test and then keep testing if it's not required? Will that soon be a part of the guidelines? I think that one's for me mostly. So no, you do not need to test out of isolation. Let me just, again, kind of talk you through this. So, and I like that you use the word isolation. A lot of times people interchange the word isolation and quarantine, and I don't mind when people do that, but isolation literally means I have COVID. I am positive. I am isolating. And for that, you got to stay home for 5 days and then mask days 6 through 10 if you're feeling better. That hasn't changed. That's true in school. And there is not a requirement to test out of isolation. Now, President Biden sees a lot of people who may be high risk. It's, and so I think in that case, my sense is President Biden gets a COVID test probably every day of his life. I don't know that for a fact, but I wouldn't be surprised. And so really, the protocol that President Biden follows is not the protocol that the general world needs to follow. And let me explain why. So first of all, if you are doing if you go and get a PCR test, those are really sensitive. Those can stay positive for a very, very long time. Even when the virus is dead, you're not spreading COVID, it's not a risk. And so definitely we have said you do not need to show a negative test because people can have positive tests that go for a long time and yet they are not, they are not contagious anymore. I think the home tests are a little trickier, and certainly we've heard some people say, well, but isn't it okay if I can show that I have a negative test that I then don't have to be worried, days 6 through 10. And I'll tell you that the worry is certainly less if you are getting a negative test, but a positive is always a positive on home tests. We don't really see false positives, but you can sometimes get these false negatives. If somebody's not getting a good swab, and especially with Omicron and these more recent, BA.4/5, sort of like what Biden had, we're seeing a little more of this, where sometimes people can be positive, negative, positive, up and down. We don't want people trying to run their life on these tests, and that's why we actually settle on the at home for 5 days, but then mask days 6 through 10. Because if you test negative at day 6, probably you're in pretty good shape. But we see people who test negative at day 6 who can still spread it. And so the recommendation for that masking is really at the population level. What do we do to limit that risk? And so, during days 6 through 10, put the mask on. It's not the time to go visit your very immunocompromised grandma, et cetera. And if you're doing other testing sort of for your own, interest or peace of mind, great. But it does not change the recommendation. And I do not anticipate CDC changing those anytime soon because I don't think the science has changed.
And Dr. Awadi, I think I just want to emphasize this with families again. Again, we want to be, safety is our priority. And as a parent myself of a soon-to-be 12-year-old and an 8-year-old, I will tell you, whenever my children get sick, I just feel helpless. I mean,
Yeah.
it is a point where it's just so difficult as a parent to go through that. So please, families, just be patient with us as we look at, as we're putting these procedures in place. We are going to be, when there's a case in the classroom, we are going to be strongly, recommending and requiring, at times, masking in those classrooms during those 10 days. Definitely for unvaccinated students, but even for vaccinated students, I really want our families to work with us, because we'll have the mask there, so you don't have to worry about having the mask. But it really is because of what Dr. Wadi described. We want to make sure we're taking every single precaution to just prevent an outbreak in that classroom. Because I know that as soon as I hear the word outbreak, I get nervous.
Yep.
And I get nervous as a parent. And so for us, we want to minimize that. And we had so much success in the program, in our program that we had with the 40+ schools, plus all the summer programs. We had so much success, so we want to be able to continue that into our school year.
Great. So a couple of quick ones for me here, I think. Melissa Allen on Facebook is saying, will people under 50 be able to get the second Kuvit booster anytime soon? No, because we are anticipating the updated COVID vaccine probably next month, probably mid-September, it's looking like, mid to late September, possibly early October. And so there will not be another recommendation, because, I'm really pleased about this. Remember, this is the updated vaccine that has been, had some changes to make it better able to fight off the variants, right? The vaccines we've been using were developed against the original version, and Delta and Omicron have been so much more contagious that I'm very hopeful that this vaccine will help a lot with breakthrough infections. It's already, thankfully, the original vaccine continues to do a beautiful job at helping keep people out of the hospital, helping keep people from dying. I mean, it's been amazing. It's been absolutely changed the way we think about COVID. However, the updated vaccine, I'm very excited about. And so given that that is coming next month, we will not be recommending a second booster for people under 50. If you are someone who has been waiting and saying, I'm not sure, should I get my booster? Maybe I should wait. Right now is when you should get your old booster, because you don't want to be getting a booster like 2 weeks before you get the updated vaccine. So we're sort of running out of time a little bit, frankly. And so if you're one of those people who is like, I'm going to wait, I'm going to see, right now, ages 5 and up, get your booster. And then know that potentially as soon as next month, we're going to have an updated vaccine. And of course, we'll share more about that. And a number of you, Faith State was asking what's happening with the new booster. We're not really using booster, I don't think, because it really is an updated vaccine. And so as opposed to like a booster of the exact same vaccine, it's really the updated vaccine. And I'm very excited about that. Okay. And then a couple here, Diaz Shin on Facebook says, has everyone basically had COVID by now? And Lisa Balde Venaria from Facebook says, does everyone who gets COVID now have symptoms? It seems like most people I know who test positive are getting symptoms, as opposed to earlier in the pandemic, many had none. So for Diaz Shin, there are actually still a lot of people that have not had a COVID infection. I have not had a COVID infection. However, there are not very many people who have not had a COVID immune lesson at this point, meaning there are very few people who are not there are very few people who are both unvaccinated and have not had COVID. So when you look at they do these serology studies, well over 95, at this point it's 98% probably, I would say, of people have either been vaccinated or had COVID or both. And that is part of why it is behaving in the way it is. We're seeing many fewer people be hospitalized or die, but still, it's the folks who aren't vaccinated and up to date that are more likely to have those severe outcomes. And so that's where we are. And I do think I'm excited about the updated vaccine, even personally, because I'm a little surprised I haven't had COVID yet. I've been out and about every day of this entire pandemic, but I am very careful. I wear my mask indoors. I test a lot. I follow my own advice. And I haven't actually had it. And I'm pleased about that. I don't want people thinking, oh, I should try to get COVID and get it over with. No. But I am looking forward to being able to get an updated vaccine that I know will increase my protection even more. And on Lisa's question, does everyone have symptoms? So we are seeing a lot of, especially upper respiratory, cold type, sore throats, still fever with this Omicron variant. And I've talked about this a little bit before. What we see is that this moves so fast, it's so contagious that often people can get infected, less likely that they're going to get the really sort of full body, long, really serious infection, because that's the other part of your immune system that kicks in and is working well. But there certainly are still some people, I am quite sure, who are positive for COVID and don't have symptoms. And that's part of why, like in CPS, this test to stay approach is recognizing that as we are moving away from quarantine as much as a society, right? We're not moving away from isolation. I have COVID, I stay home. Quarantine is, I don't have COVID, but I might have been exposed. As we move away from that, as we want people back at school and back at work, generally, there are still settings where it's in place, it's going to be important that masking and testing are a piece of that. And so the reason why, if you've got a child in school who has COVID, you're going to want to offer testing a couple different times, is that we do expect that there are, especially kids, may be positive and not know it. And so that test to stay, that goal of using testing in a way to help kids stay in school is, I think, a really good balance between using those tests where the risk is higher, not putting extra burden on parents, but then also not having children who need to isolate be out. So that's what I would say to that. Okay, let's get a couple more. Danielle Dupre Sullivan. So first she has a nice shout out. She says the mobile vaccination program was a hit. No fuss, no muss. I highly recommend it. Thank you, Danielle. Agree. And then she's asking, are teachers and administrators making sure they're vaccinated and boosted too?
Yeah, so the good news is almost virtually almost all of our staff, close to 100%, are vaccinated. The few that are not mostly have medical or religious waivers, and we work with them very closely to make sure that that they're not in a higher risk. And so I'm actually very proud of the fact that our team, for the most part, is close to being fully vaccinated. And we'll continue, we're all frankly I'm looking forward to the new vaccine, the updated vaccine. I think that's the only thing we're waiting for now.
All right, and here's another one. If my child tests positive for COVID during the school year, do I call the school? How do I notify the school? And do you still have the safety committees?
Yeah, so yes, we do have the safety committees, and so part of the guidance we will make sure families have is how you contact our team to make sure that we know that you have a child that's positive. So we'll be really working with your school, but we will make sure you have that very specific details, because that is the way we're going to make sure that we do implement our test to stay model, because we need to be aware of all cases in schools.
Absolutely. All right. So Francie Swidler is saying, knowing that so many people have gotten COVID, are the CDC's isolation and quarantine guidelines working anymore? As a doctor, can you share additional things you think we should be doing? Should the guidelines evolve, and if so, how? So I do think that the guidelines are evolving, and in fact, you noted we're hearing some conversations around this, and especially in schools, everybody's got the same goals: have kids in school, but in a way that is safe. And already there's been a decision at CPS to go far beyond what I think what the CDC is likely to recommend, even in its updated guidance. Yes. Things like having routine testing in place, yes, like for anybody who wants it. That is pretty unusual, actually, at this point, but I think it helps. Having this very strong test to stay when there have been cases. Let's get tests into that setting. Let's work to try to keep the kids in school. Let's have masks in place, but in a judicious way. Yes. And then if we've got an outbreak, that's when we have to really get more, and none of that has changed. And so I do think, Francie, to your question, that there are going to be updated guidelines coming, and I believe they're going to be doubling down on this idea of isolation. Isolation. I am sick. You got to be home. You got to mask. And I think we'll see more of if you've potentially been in contact, wear that mask, get tested, exactly sort of what we're seeing in some of the guidance here. And then the big thing is going to be when the updated vaccine is available, get that vaccine. And there's Mary Rodriguez on Facebook has a good question. Will people be able to get the flu shot and the updated COVID vaccine shot simultaneously? I think so. We, of course, are waiting for final guidance on that. But we were able to administer at the same time flu vaccine and the other COVID vaccine, and we can give multiple pull vaccines to people. It doesn't overwhelm their immune system, et cetera. And so we are doing a lot of planning at CDPH for September, because let me tell you, September is already a busy month for us from a vaccination standpoint. We're helping get kids caught up on back to school vaccines for their regular vaccines. Right. We're of course continuing with COVID, and then now here comes potentially a pretty significant COVID booster shot. We've got this large monkeypox vaccine, MPV vaccine campaign going, and then it often is the beginning of our flu shot campaign. So we already have things in place. We've planned, we've offered vaccine clinics to all the aldermen's offices. We've got things planned with city colleges, and likely, depending on the timing, there's a good chance that at least some of these we will have flu and updated COVID available. And that, through pharmacies, that will also be available. So more to come on that for sure. But I'm excited because having this available ahead of major cold weather here is really good for us. Okay. Kristen Lambert on Twitter, and we're just about at time. What metrics would make masks mandatory in CPS again? She notes Chicago is red on the CDC map.
So first of all, we've always said we'll always do that in concert with our medical professionals. Yep. And I really appreciate, Dr. Arwady, how nuanced you get into hospitalization rates,
yep.
death rates. Of course, let's repeat this. If there's an outbreak in a school, and
That's
multiple
right.
outbreaks, CDPH will not hesitate to require masking in classrooms, even school-wide. So that could happen at any point in time, regardless of what the risk factor is in the county or in the city. Other than that, we will continue to work with you, Dr. Arwady, and and really, you have the lens of the whole city.
Yeah. Yeah, and I fully agree. That's the same way. Basically, I hope we don't need to make masks mandatory for everybody across the city again. But we would do it if, here's the settings where we would do it. We would do it if we were significantly threatening our healthcare system. And there's some metrics that we've laid out about what that looks like, hospitalization numbers, et cetera. We would do that if there were a new variant of high concern, meaning a variant where the vaccine isn't really working, or the tests aren't working, or the vaccine isn't working, and we need to sort of quickly get on top of that. But in the absence of that, we really are thinking of, and to be clear, if the city were requiring masks indoors, CPS would require masks indoors. Right. So that really would follow. And I'm hoping that isn't something we need, but last January when Omicron really hit hard, we had a mask requirement in place. I very much hope that doesn't happen again this year, but if we started to see, especially people getting seriously ill and any threat to the healthcare system, we would do that again at the city level, and that would include not just CPS, but other schools. And we would do that just to get us through that surge and protect the healthcare system. So hoping we won't need it, but it will be something that remains on the table, and COVID has not been easy to predict all the time here. And so I think we're in the right place in terms of encouraging people to wear masks indoors, especially if they're unvaccinated, not requiring it. But if we get to a point where there's a variant that is really putting people at risk, or we're threatening the healthcare system, we would do it. And that would be done through the Chicago Department of Public Health and then apply to schools and other settings. Okay, we are at time. So I think we got a good number of your questions in. Thank you all. Really, really good questions. Maybe I'll just take as this very last. On the first day of school, does my child need to wear a mask? Why don't you finish off with that one?
So we are still strongly recommending masking, so they're not required. So please, as a parent, we always say, parents, we want you to be judicious. My children are vaccinated. My son will wear a mask because that's what he does. My daughter, we have to encourage her. So we are still strongly encouraging masking, but it's not required.
There you go. Perfect. So I hope this has helped. I really, know that we've been working together. CPS and really our schools around Chicago have been doing a lot of preparation for the upcoming school year. And there are a huge amount of resources that have gone into this at CPS. Yes. And, COVID continues to change, and it's important that the protocols continue to evolve as we learn more. So I think we're in a good place heading into the school year. And certainly if you have questions for CPS, direct them to CPS. And I know, they're sending out letters, they're doing lots of communications, but a good opportunity here. And thank you for all of your really good questions. I will not be back next week because, as you heard me say, I will be on vacation. My team is all over all things. So if we really need to have an update on monkeypox or something, someone else may host. But at the moment, we're not planning to have a Facebook. And I know you'll have separate communications. Back to school bashes heading in. Anything you want to just finish off with?
No, but parents, we do have 3 back to school bashes. We have one today at Fenger High School. We have one on Thursday at Michelle Clark. And we have our last one at Finkel. So please, we have information about COVID, we have information about vaccines, and of course we have backpacks and supplies and so many activities for families. So please join us, and we're excited to receive you on August 22nd.
All right, back to school time. I love it. Thanks so much for joining CEO Pedro Martinez of Chicago Public Schools. We'll be back with a Facebook Live August 23. Thanks.